This is not an Insta lecture. Today I am starting a new series called 3 Remarkable Features of Certain Diseases. That means I would just highlight 3 features which are worthy of remarkable about this disease or disease process. So, as some of you requested, the topic of the day is cardiac metastasis. That means those tumors which love to travel or visit or metastasize to heart. The first point that is worthy of remark is that cardiac metastasis is much more common than the primary cardiac tumors. Primary cardiac tumors are quite rare. Cardiac metastasis is 30 times more common, 30x more common than the primary cardiac tumors. This is the number one, I feel, which is worthy of remark. Number two, that you need to know that what is the most common way of spread of tumor to the heart or cancer to the heart. Answer would be retrograde lymphatics. Actually, it can come from that the cancers can reach to the heart in many ways. It can be hematogenous route, it can be lymphatics, it can be direct extension. All these are there, but the most common is retrograde lymphatics route. Third thing is that what is the most common tumor the most common tumors which usually love to metastasize to the heart. Now there are two ways to look at it. There are certain cancers which actually has a higher propensity, higher frequency, I would say, to metastasize to the heart. That is malignant melanoma or just melanoma actually of skin. So melanoma shows an unusual love affair with the heart to metastasize there. That means they have a much more higher propensity to metastasize to the heart. But overall, if you look at that, what are the cancers which comes to the heart and metastasize to the heart, then the number one will be lung cancer, lung carcinoma. So overall, the most common cancer, number wise, is lung cancer. But if you see that if a cancer, the majority of them are coming to the heart, the higher frequency, then it would be melanoma. This is the way to look at it. And usually the lung cancer, hematologic cancer and breast cancer, they comprises 2/3 of this thing, most of the cardiac metastasis. Next is, I would say, to look at that which part of the heart is most commonly involved by metastasis. Answer would be pericardium. Pericardium is the most common part of the heart which is involved by metastasis, and that's why a lot of metastatic tumors can present with a pericardial effusion. That's a very important way to look at it. The last thing is that cardiac metastasis has a very poor prognosis. 5-year survival rate is only 7%. That means a very poor dismal prognosis. So that's all. These are the key things actually you need to know about this. And last thing I would like to add that all parts of the heart can be involved by the cardiac metastasis, but usually heart valves are not involved. Why? Because it is constantly in the motion and it has a poor vascularity. That's why usually the heart valves are spared from the cardiac metastasis. So that's all from me. Thank you so much.